want to thank everybody for coming down. It's a monumental occasion for the board and the hospital. I'll keep my remarks short as I usually do. But I want to thank the staff in general because they showed us there was a demand for what we want to do here today. And I want to thank the administration because they got it done. And I want to thank the board mainly because we approved it and got out of the way. So welcome, and let's go on with the other speakers. Thanks.
It is my privilege to introduce Memorial's President and CEO, Joe Ruffolo.
Let me apologize up front. Unfortunately, I'm not going to be as brief as our board chair. Just haven't acquired that talent and that skill yet. I'm still working on it. But good morning, welcome. Thank you all for taking time out of your very, very busy schedules to join with us today in this celebration. And I'd like to begin with a true story about an individual by the name of Carl. Carl is a 52-year-old male who is intellectually disabled and has severe asthma. He's a frequent visitor of the emergency room due to a number of his asthma flare-ups. Carl has a self-care deficit, limited social functioning, and he lacks self-direction. Carl lived with his biological mother for most of his adult life. But after his mother's death, Carl's life rapidly went into a crisis mode. Carl was bounced from his primary residence, where he lived most of his life, to multiple boarding houses. His physical appearance became disheveled, emitted a foul odor. His hair became long and unruly. His skin covered in dirt. He wore the same clothes, and each time he was seen, his clothes were much too large for his body, quite often covered in the same stains. Carl was immediately evaluated and enrolled in our health home. Upon evaluation, the care manager identified that Carl was paying $475 a month for a single occupancy, very cramped bedroom in a debilitated building. He frequently was subjected to attacks by fellow boarders who took his money on a regular basis. The health home care manager began coordinating these services immediately, finding Carl a safer place to live, a far more cost-effective apartment for him. In addition, we established a representative payee to manage Carl's money. He was immediately linked to our primary care services, linked to our behavioral health and wellness services. His medications for asthma have been ordered, and not only ordered, but they are routinely delivered to his new residence. Since joining the health home, Carl has established a very strong, trusting relationship with his care manager. He has not been in the emergency room since. He has shown a significant improvement in hygiene and self-care and was proud to show off his new haircut. He enjoys now eating in a local soup kitchen and has actually began socializing with other diners. The message here is the quality of life for Carl has vastly improved thanks to the coordinated and dedicated efforts of our health home team led by its director, Vicki Landis. Sadly, despite the great work of many of our community agencies, there are many Carls among our midst. According to a report published just last month in the USA Today, more than 56 million Americans have some form of disability. And while there is considerable support for children with special needs, we all know there is much, much less support for when they become adults. This leaves many disabled adults unemployed, living with their parents, unable to provide for their own, And many of these adults, like Carl, are outliving their caregivers, creating a new type of service crisis. Many individuals who are part of the Memorial family are addressing this disparity. For example, under the leadership of Dr. Scott Darnell, who is Memorial's Medical Director for Sports Medicine Services, he leads a team of our family practice residents and medical students who volunteer countless hours in providing medical care to Special Olympians at the annual Special Olympic events. And here in Niagara County, in Niagara community, as Carl's story illustrates, we see the need for vastly improved care pathways, especially for those with developmental and intellectual challenges. Addressing what has clearly become an acute need for the estimated 4,000 intellectually and developmentally disabled individuals living in Niagara County, of which 1,000 are children among them, this must become our community priority. This is a medically underserved population that has very complex and very unique care needs. Yet only about half are believed to routinely receive the type of care that they need. Memorial's ongoing transformation, moving away from a traditional hospital to a center for community health, we feel is improving and sustaining the health and well-being of our community. Our transition places a very distinct emphasis on coordinating services for the most vulnerable population among us to prevent them, like Carl, to prevent them from falling through the cracks. You will learn this morning we've embraced an innovative and integrated community-based service model in collaboration with many community agencies and providers to remove those barriers to care that can result in gaps of service linkages, service delays, or quite frankly, no service at all. Tom Golisano, the entrepreneur, the philanthropist, the civic leader, has left an indelible mark on a broad spectrum of issues that touch our lives. As many of you know, he's the founder and chairman of the board of Paychecks. He leads more than 12,000 employees in over 100 office locations across the country, providing payroll, human resource, and benefit outsourcing solutions for more than 500,000 small and medium-sized businesses. But his personal side outweighs all that. His personal philanthropic contributions to hospitals, educational institutions, and other organizations have totaled more than $200 million. He's a fierce advocate for dignity and inclusion. Tom Golisano applied his pioneering spirit to establish the Golisano Foundation to help make the world a better place for people, especially those people with intellectual and developmental challenges. The Golisano Foundation is now the nation's leading foundation dedicated to helping individuals with intellectual disabilities. For over 30 years, the foundation has worked to open doors, change perceptions, forge partnerships to help provide individuals with intellectual and development disabilities with pathways to self-sufficiency, personal dignity, and the best possible expression of their abilities and their talents. In my opinion, and I'm sure those closest to him, this is what this extremely successful, world-renowned business leader is all about. Simply put, he cares for those who cannot care for themselves. If there's anybody who really understands that impetus behind this generosity of spirit, it's our next speaker. Ann Costello has worked for more than 25 years in the nonprofit sector, primarily in the area of human service administration, strategic planning, fund distribution, organization, policy development. Since joining the Golisano Foundation as director in 1999, she has witnessed rapid growth and change in total foundation assets and annual distribution of funds. For those of you that aren't aware, the Golisano Foundation has a global, not national, but a global presence. With its workings, it's recently been featured in 2 national conferences, and Ann's work continues to expand the Foundation's role in public policy related to disability services. As a matter of fact, she wouldn't state it, but I will. She was recently invited to attend a small gathering at the White House with President Obama. Ann has redefined the Foundation's role in the disability service arena as a, quote, proactive partner and a catalyst for transformation, especially when it comes to the way communities support individuals with intellectual and developmental disabilities. Under her leadership, the Foundation has supported and launched many partnerships and programs to this end. She has traveled the globe, an advocate and participant in the advancement of the Healthy Communities Initiative launched by the Special Olympics over 2 years ago, thanks to a $12 million gift from Tom Golisano to expand health-related services to people with intellectual disabilities. Please join me in extending a very warm welcome to Golisano Foundation Director Ann Costello.
Thank you, Joe. That was a tremendous and very generous introduction, not only about myself, but certainly of Tom and his passion. I'm pleased to be here today for this transformative announcement. Words that we live by at the Golisano Foundation that reflect Tom's business and philanthropic endeavors are imagine the possibilities. Now again, if you know Tom Golisano, he's always imagining the possibilities. And that's just what Niagara Memorial Health Center did. They imagined what health services should be and can be for those who typically fall through the cracks. And we are honored to partner with you in this endeavor. As Joe mentioned, the cause that's closest to Tom Golisano's heart, a cause and an issue that has touched his family, is to help those with intellectual and developmental disabilities. At the Foundation and in much of his personal philanthropy, our mission is to target initiatives that encourage and commit to inclusion, acceptance, and opportunity for those people with intellectual disabilities. And we want to support services that empower them to make their way productively and creatively in their communities. And I think if you reflect on the story that Carl talked about this morning, that Joe talked about this morning with Carl, that's exactly what Niagara Falls Memorial has done. Helped Carl live his life creatively and productively, and to help him feel included and accepted in his community. Your vision for this integrated healthcare center is exactly what the mission of the Foundation has set out to achieve. In one location, Niagara Falls Memorial will provide primary health care, behavioral health services, health home coordination care, community outreach, and satellite offices for community-based partners of developmental disability services. And they didn't stop there. They're actually creating a learning hub, as they call it, that will house their residency program and internships to train future clinicians and healthcare workers to treat and take care of people with disabilities. The training of our future generation of clinicians is critical if we're to close the gap of health disparities for people who typically fall through the cracks. When we learned about what Niagara Falls Memorial wanted to do, we knew right away that it perfectly aligned with the program that Joe talked about that we helped launch 2 years ago called Healthy Communities with Special Olympics. As they know and continue to demonstrate, true healthy communities include everybody, especially those who are most vulnerable. And again, that's exactly what this new Center for Community Health will achieve. We look forward to working with Niagara Falls Memorial in the coming years to learn more and to work more closely with them to understand the needs of people with intellectual and developmental disabilities in Western New York so that we can assess and perhaps help with future support needs. Joe, you and your team are real leaders. You are paving the way for how healthcare can be and should be delivered. I have no doubt that this center is going to be the model, not only in Western New York, but across the state and the nation. So now, on behalf of the Golisano Foundation and Tom Golisano, it is my pleasure to announce our commitment of $3.5 million to Niagara Falls Memorial Health Center to build the new Center for Community Health. Thank you so much, Joe.
So how would you like to be a speaker to follow that? We gotta pick your spots. That's why Jimmy goes first. So, it's speechless as usual, but really accept to, on behalf of the Memorial family, our very heartfelt, sincere appreciation to both you, Ann, and to Tom for making this investment that is going to really make a difference in improving the quality of life, especially for those that can't care for their own. Thank you. Just off script here a little bit, when Tom Golisano came to visit us for the meeting, we met in the boardroom, and after about 15 minutes, he says, we got a break. Let's take a break. And he said, I'm going to go outside and make a couple of calls. And so Tom walked outside on 10th Street, sat at a bench in front of the hospital. All kinds of people walking by. No one recognized who he was. He's on his phone observing. Of course, my first call was to security. And I told our security guards, yesterday you were security guards, today you are Secret Service. But there are some others that I do need to express a strong thanks to. Certainly Dan and Jan DePofi. I know you're here somewhere. Yes. There you are. Very strong community advocates for this program. Dan had a personal medical issue that Memorial took care of, and who would have thought it would have ended up in a situation like this. So if you have any other body parts that you need, we'll be happy to help. And next to Dan is Judy Nolan Powell, who's the chair of our Memorial's Development Committee, for her tireless efforts in making this come to fruition. And as Jimmy said, our entire board of directors really they deserve thanks for being flexible and nimble, open-mindedness, and really sharing and buying into the vision of what population health management, especially as it relates to this special needs population, is really all about. Like in The Wizard of Oz, there's always the wizard behind the curtain. That wizard is Sheila Key. She's the one that creates a lot of the innovation thought processes in terms of integrating care models to help people from falling through the cracks. Deserves an awful lot of credit. Of course, Vicki Landis, our director of our health home, and Dr. Preeti Bath, who you're going to hear from in a moment, in terms of dedicating their careers to helping this very special population. And also to Jeff Sanderson, the Chief Executive Officer of Rivershore, and his colleagues at People for really sharing in the vision and coming together so quickly. We really couldn't have planned it better if we wanted to rehearse this several times. It just was just a natural fit. And to Buddy Campbell, Chief Executive Officer of the YMCA, and the Niagara Director, Greg Larson, for their willingness to provide specific programming for fitness and wellness activities that will be tailored to the clients that will walk through the doors of the center. Of course, the Mayor Deister, and the City Administration, City Council for their continued support, and to our folks at Canon, Elizabeth Peralt and John Hall, for coming together very quickly in terms of creating the design, the concept to get this project going. So thank you all for participating with us today.
Again, a very heartfelt thank you to Tom Golisano and the Golisano Foundation for this extraordinarily generous gift. This is the single largest gift Memorial has ever received, and again, we are so grateful, and I think that deserves another round of applause.